Hi, I'm Dr. Richard Jermyn, Dean of Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, our podcast series dedicated to highlighting the thought leaders who are advancing the mission of our medical school. Our mission is to foster innovation, elevate excellence in education, and advance transformative healthcare practices. Today we are thrilled to have Dr. Ann Jones, who's an SOM alum with a Master's of Public Health. She is Rowan-Virtua School of Osteopathic Medicine's Assistant Dean of Student Affairs and Associate Professor of Family Medicine. Dr. Jones oversees the activities of students outside the classroom, as well as manages the areas of student professionalism, code of conduct, disciplinary complaints, and holistic support. She's a grant-funded researcher that has developed student-led projects around integrated behavioral health and mental health, inclusion and development of health systems and policy to promote holistic care. Her leadership roles and experience during the COVID pandemic have enriched her teaching, ethical practices, research, and her leadership. Welcome, Dr. Jones.
Thank you.
I say this all the time. One of my biggest thrills as becoming dean was you accepting your position. So I want to thank you for doing that.
Thank you very much for the opportunity.
Let's talk a little bit about this role. You know, the Office of Student Affairs, you and I had this conversation when you kind of took over. It's building up students, but disciplinary is in there too. Mm-hmm. So it's like happy, it's a little scary.
Yes.
What is the culture of your department?
Yes. Thank you. Thank you for asking, and it's a great opportunity to talk about it. So student affairs is sometimes thought of like two ends of a spectrum. But I kind of see it if in the football analogy, because I know you're a football fan, or actually in any sport analogy. So it's the idea that in any institution of higher education, there's the supporting of all students. So in student affairs, our main mission is to support all students, to make sure that students are getting in the game, in the academic context. And what we're doing is we're providing that support outside of the classroom so that they can excel inside the classroom. What's also very important in any sport context is establishing the playing field. So establishing the playing field so students are playing a fair game with each other, are abiding by the rules and the established groundwork and norms and conduct that's accepted in the community of being a physician, and that is instituted fairly so that people are playing fair, but they're also having fun.
And they do. I
Yes.
see lots of fun in your department.
Yes.
You also have the longest hallway a human being could possibly walk down to get to your office.
This is true.
I said if I ever I would be nervous if I ever, I'm like, by the time I got to your office. So anyhow, let's circle back a little bit. Let's talk about professionalism, all right? Because that's such a broad term, right? And part of our goal, obviously, is to make sure that when a student graduates, that they have a high level professionalism. But I think the definition of professionalism has been kind of changing.
Yes.
And so can you talk to me a little bit about that?
Definitely. So, you know, in the world of academic medicine, professionalism has been a competency of medical education. Yes. So it's among the basic pillars of what it means to be a good physician. So medical knowledge, clinical competency, systems-based practice, and professionalism is one of them as well. But I think for many, many years and decades, professionalism has been seen as this binary element where a student is either very professional or not professional, which is akin to kind of a fixed mindset. And in medical education, we have been trying to change that narrative to see professionalism as a set of skills that can be learned and taught and developed, and that people can be human and make mistakes through those skills, through learning those skills. I kind of use the analogy of a stethoscope. You know, when students first come into school, Do most students know how to use a stethoscope? Usually not, right? Or if they have used a stethoscope before, they haven't used it in the context of medical school. So we're teaching the skills of how to put that stethoscope on, how to put it in your ears, how to change it up so that you can hear the best that you can, and then being able to get those skills down before you're actually listening to heart sounds to make a diagnosis. Professionalism has the same types of elements to it. It isn't just you're very professional or you're not. Or said in another way, you're either born professional with a set of skills or you're not. It's not a characteristic or a set of character traits that are either good or bad. It's a set of skills that can be taught and developed. And in medical education, we know that we can teach them and build those skills as students are going through their education. So the Office of Student Affairs actually takes on both the oversight of that professionalism process, where we look at lapses and needs for remediation among students. We're also involved in teaching and developing skills. And really that's the main focus. As an assistant professor, I teach in the curriculum. So I'm teaching skills of professionalism, hoping to build those skills in the first and second year, and then being able to bring them to clinical practices when they're in third and fourth year.
I want to circle back with something you said a little bit earlier. You said about mistakes. Mm-hmm. Students are allowed to make mistakes. If you were not a student, you wouldn't make mistakes, right? Like that's the idea.
Yes.
So I've been playing with it, and we've had a couple of podcasts in the past just about, we do things a little bit differently here at SOM. We put students in vulnerable communities, we put them in, and I feel really strongly for their education that we make them uncomfortable, right? On purpose, right? So the first time is in an environment that you're going to feel uncomfortable isn't when you're the doctor, right? It should be when you're the student. So let's circle back about making mistakes a little bit, why that's okay, and maybe we could talk a little bit about forgiveness.
Yes, definitely. That's very important. So I think sometimes it's normal for a trainee to think or say, well, I'll be professional when I'm in a clinical environment. And what does that mean? I'll be on time when I'm in a clinical rotation, or I'll get all my paperwork in when it's about a patient. But the fact is that if those skills aren't built beforehand, then being on time, getting paperwork in, doing the things that one needs to do in a clinical context aren't practiced. And then when you're in real time, then the lapses occur that actually make a difference. And so what we've been doing is in first and second year, we've been paying attention to things in which those skills are important so that the skills and the behaviors can be practiced in first and second year. So being on time to class, turning in paperwork, attesting to what you're doing as a physician. One of the things we talk about all the time is, as physicians, every time we, for example, prescribe a controlled substance medication, we not only have to do the prescription, we have to check the PMP, we have to then attest that we've checked the PMP, we have to put that in our note, and then we have to do a dual factor sign off for the prescription. So this idea that you need to be attesting to doing what you say that you're doing is the same kind of skill that you have to build in the first and second year. It's not just important to be in the class. It's important to say that you were in the class, to sign the paperwork that you were there, to put your name on the list, to complete the evaluation, because these are all of the things that are skills that are and expectations that are required of physicians in practice. And so those are a couple of examples. CME is another example. I tell this story a lot for students. The first time that I ever went to a CME conference, I was in the room, I attended all the lectures, and then at the end of the year, I noticed, the CME wasn't on my transcript. So I called up the CME organization and I said, I went to this CME conference, and they said, well, did you attest that you were there? And did you sign the evaluation? Because if you didn't meet the requirements of CME. It's the same thing. So these same requirements that are going to be expected as physicians in practice, we're placing those expectations in the first and second year so that students can begin to know and understand what that feels like as they go through their curriculum.
Yeah, maybe a word a little bit, when students mess up, they get, and by the way, attendings too.
Yes.
You kind of get into this spiral a little bit about, well, I didn't mean this, or I didn't mean to the way this came out. And I think for a lot of our students, they go into a bad space a little bit,
right?
Where they're like, but part of your training is to learn this is the way you're supposed to do it.
Yes.
And you also have to forgive yourself.
Yes.
Like, well-intended people, tend to blame themselves a little bit.
Yes.
And it's just, sometimes it's not met. A great example would be an insensitive joke, right? Well, I didn't mean it that way. But the reality is it could offend other people, and so forgive yourself. Allow yourself the ability to say, I forgive you. And I think we need to forgive other people too.
Yeah.
In today's day and age, especially where there's so much conflict, you don't have to agree, right? If you're offended, have the grace to be able to also forgive that person.
That really resonates with me, and it brings up a few different concepts that I talk to students about quite a lot and that we in Student Affairs try to espouse. The first one is intention versus impact. So I think I heard you describe that just now. So we can be well-intentioned, but how that's received by another person, whether that be a patient or a colleague or another physician or a member of the team, is just as important. And the goal of one of the goals of being a very professional physician, I think, is trying to close the gap between intention and impact as much as we can, so that what we're saying and what we're doing are lining up with each other, and also to make it our goal to understand when that doesn't happen and then learn from that. That's called cultural humility, right?
Absolutely.
That is the basis of being able to provide care using a health equity approach.
Yes.
And it's recognizing that those implicit biases, those assumptions that we make are automatic for our brains and are because of the environment in which we have learned and come from before we came here to medical school. And so all of those influences come together, and when a student is in medical school, they're interacting in an environment that they may never have been before. And instead of thinking, I never want to make a mistake because I want to do this perfectly, and similarly for us, instead of giving cues to students that make it seem like they can't make a mistake or they have to be perfect, we have to be willing to be okay with being imperfect. And thus we, as the institution, should be okay with allowing that to happen and giving a space for learning.
And I think it also says, that in that space, you have to do the learning too.
Yes.
And repeated, violations can be a little bit difficult.
Yes.
Now, I want to go away from that component, the disciplinary component, that you initiated something that was mind-boggling to me in a positive way. You also reward really good behavior.
Yes.
Tell me a little bit about that.
Yes. So in the new professionalism system that we implemented this year, we have a system that is holistic. So just as we are an osteopathic school, whole person approach, and we aim to train physicians who can give that care to patients, we try to give that approach to students as well, recognizing that there's always a context to why a certain behavior or mistake occurs. And similarly, we want to reward and really lift up the positive behavior that we see. So we instituted as part of that process professionalism commendations. So yeah, normally in a student affairs office, we're talking about discipline, remediation. When problems happen, we're the office that you see in addition to having fun. But what we try to do is say what's as important as looking at when mistakes happen is being able to call out when really bright spots happen. And so we instituted that as a holistic process. And those commendations get fed back to students right away. So they hear that positive feedback that's coming from across the SOM community. And that includes within SOM here at Stratford and at Sewell, as well as our hospital partners, our hub sites. We've had some wonderful feedback coming in.
I've seen it. Thank you for CCing me on the
Yes.
emails when they come in.
Yeah.
It's a dopamine blast to my brain
Yes.
every time I see the great work our students are doing.
Yeah.
And I very, very proudly go out to all our hospital affiliates saying how we have the best medical students in the country. We absolutely do.
Yes, we do.
And to be able to see these highlighted, I think is everything. So just a word to our students, like, let's get some more of these,
Yes.
out there.
Yes.
And I really very much enjoy that. Tell me a little bit about your research.
Thank you. My research is in integrated behavioral health and primary care. And I love being a family physician. I'm in practice at the Sewell site. And I'm also sort of similarly an osteopathic family physician who practices holistically. One of the major needs, I think, in our community is in mental health and mental health access, as well as coordination of care. And so in my clinical experience prior to coming to SOM, I was really passionate about integrating mental health services into primary care, it being really the front line of where patients meet the healthcare system in many ways. And so, so it's been wonderful. We've had a few grant projects in our office that is exploring this, and we've actually been able to get students involved in this research where they're coming in and actually working alongside clinical psychology students at Rowan University and exploring the logistics of integrating this into our primary care practice. So it's been exciting.
And you and I spoke about this before. I wholeheartedly agree with interprofessional, interdisciplinary training is it's hallmark to the osteopathic profession to begin with, but we have to be realistic about the future. And the reality is we need to train our physicians not only to be great physicians, which we are, but also team leaders.
Yes.
And so I very, very much appreciate your research and the work that you're doing. More to come with this.
Thank you.
I'm enamored by it, to be honest with you, and I know that this is built into our curriculum and much more is coming. So I appreciate that. I'm going to ask you one last question, and this is for our incoming class. One bit of advice to your incoming students from their dean.
Absolutely. Thank you. There would be many pieces of advice, I think. But I think one important piece of advice I'd give is to remember that the light is on you right now. It's not necessarily at the end of the tunnel. And what do I mean by that? I think that the field of medicine sets up a very linear pathway where there's an expectation of first you do this, then you do this, then you do this. And it starts in the beginning. The exams, and then the boards, and then COMLEX, and then rotations. And in our profession, I think it can set up this idea that it'll all be better until the next thing is over. But the fact is, when the next thing is over, the next thing begins. And so this idea of there's a light at the end of the tunnel is just an optical illusion. The light is on you right now, and it's important to stay in the moment. And if you find yourself thinking, it'll all be better when, that's a signal that you need to stop and take a rest now. That may be the first sign of burnout. That's been the case for me in my career. And I would give that as if for any student who's starting in medicine today, to be kind to yourself in that way. And along with that, and it goes back to your point about forgiveness, I think when you're in medical school and you're learning something new every day, sometimes you learn from being comfortable, and other times you really learn by being uncomfortable. But there's a difference between feeling guilty and feeling shameful. Guilt is a feeling of, oh, something happened that was bad, or something happened that didn't go according to the plan, and I'm gonna learn from that. Shame is when you think, I'm a bad person, and we don't want you to feel shame. If a student is feeling that way, it should also be a signal that you want to take care of yourself. Come to me, come to our offices, seek health and support from Student Health and Wellness Center, from your family, from your support systems that are helping you through this journey. And by all means, as you said, forgive yourself and forgive other people. This is like a third thing of what you just asked. Yeah. But I think it brings full circle the comments that you said, Dean Jermyn, that in today's social media culture, where one person can say one thing and be canceled, yes. Or ghosted.
Yes.
The stakes of making a mistake, I think, for our learners today are very high. Not just because of the medical school journey is difficult, but also because I think there are cues in society that make people worried about making a mistake, or else they'll be canceled, they'll be ghosted. I can assure you that that is not going to happen. We don't just cancel people. There is understanding built into our processes, there's due process built into our processes, and there's forgiveness. And an understanding that we're all whole people. We're osteopathic physicians. We're body, mind, and spirit. And we think of our learners that way, in addition.
I just want to thank you so much for that. The best dean of students right there. I think you saw it today. So proud. Thank you so much for all the work that you do and what you do for our students every single day. And I want to, once again, I want to thank our viewers for tuning in every month to listen to the great leaders that I'm bringing forward that help move our mission forward. So we'll see you next month. Thank you so much.